Hey everybody, welcome to the final webcast of this webcast series, part 8 of the Pediatric Summit's 8-part webcast. We have with us tonight a very special doctor, Dr. Cathy Wendland-Colby. She's a world famous speaker extraordinaire. Everybody loves her. She is amazing. She can fire you up. She can tell you the principle, tell you like it is. A lot of people like that about her. She's been in practice since 1999, and she's practicing in Woodstock, Georgia, and is just amazing. So what she focuses on is a lot of pregnancy and preconception and a lot of pregnant women in her practice, and they love her. So we are talking about tonight the detrimental effects of subluxation on preconception and in the first trimester. So, hey, Dr. Colby, how are you doing? I'm gonna switch it over to you.
I'm doing great. I'm doing great. How are you?
I am fantastic. Thank you for joining us. So our topic tonight, say again? I'm sorry, you froze up on me. What did you say?
For having me.
Oh, great. So tonight's topic, the detrimental effects of subluxation on preconception and in the first trimester. I'm sure we all know that, or we should know if we're on this webcast, that subluxation affects the nervous system globally and affects your body and health in countless ways. So instead of going through the countless ways, I wanted to kind of focus on some of the things that maybe are more pertinent that maybe the patients care about a little bit more, and specifically people that are trying to get pregnant or going to get pregnant very soon or just recently got pregnant.
Okay.
And so in practice, what would you say some of the most important topics that you communicate with your new patients about regarding subluxation in that demographic? What would you say like the top few are, their concerns?
You know, it's interesting because everybody comes to you with whatever's going on in their life. So when a new patient walks in the door, they're focused on whatever it is that brought them in. And unfortunately, in most chiropractic offices, it's a symptom that brings most people in. So they're focused on their low back pain, they're focused on their neck pain, they're focused on their headaches or their car accident, they're focused on the fact that they are having fertility challenges. So whatever brought them in, you have to meet the patients where they're at. I think it's our duty and our job to bring them where we want them to be and where they need to be to really regain their health and experience life at its fullest potential. So I always try to bring them to a conversation of what is the master control system of your human body? What started your body in the very first place when you were conceived by mom and dad? And now most people are going to guess the heart because they think the heart's in control of the whole body. And that's great. You know, you never make people wrong. I lead them to what's right. So that's great, but there's something that's actually what formed before the heart and the heart. So I go back to the moment that they were conceived, because if they can go back to that moment, at least in conversation, then they can start to understand that this isn't about the moment they're at right now, which is beat down, run down, exhausted, symptomatic, coming in for a problem. If you can get them to start understanding their entire life, what led them to this moment right here that they're now at your office, then you can really have a better conversation, which isn't a symptom-based conversation, it's a function-based conversation.
Awesome. So, and I have a little bit of experience just through clinic and whatnot. Even though you tell them and they understand, yes, the nervous system, totally get that. But my concern is such and such. And whenever you bring that conversation over, specifically, I mean, we can start on just preconception. Just what is something that you like to tell your patient, your mommy to be, that about what is this subluxation, this sublimation, this whatever? What does that have to do with them? What does that have to do with what they want out of their goals? How does it affect them?
So that's a great time period. And the reality is you want to have this conversation with every patient that walks in the door, because you want to start steering them toward this mindset that my body has to function at its best level, so that in the future I can function at my best level. It's not just about this moment right now. So when I start having that conversation, I'm gearing them up to the idea that someday go up and get married and have children. And after all, don't you want your body functioning at its best level, that you can create the healthiest sperm or the healthiest egg, and therefore create the healthiest baby possible. So that's how we get to that conversation. And I have that conversation with teenagers and kids. And of course, it's always a joke, like, you're not going to be getting married and having babies anytime soon, ha, ha, ha. But we want to make sure that your body is functioning at its best level. So when you grow up and you decide to get married, your husband has to be under chiropractic care, right? Or your wife that you're going to marry has to be under chiropractic care, because we're not wasting all this time for someone with inferior bodies and subluxated bodies to come in here and disrupt what you've worked on for so long. So we almost make it a joking conversation, but we put it in there so often that people get it. So we've got multiple generations anytime. But when it comes to a woman who, or a couple that are thinking about starting a family or adding to the family, we really steer the conversation toward the fact that, listen, you have to be functioning at your best level prior to conception in order to produce the healthiest egg that you could possibly produce, and your spouse in order to produce the healthiest sperm. Because you get one shot at building that baby. If you build that baby with an inferior egg or an inferior sperm, then that baby is going to experience a lower level of health than they could have if they were functioning at their best and had the best conception possible. So some of the research that I like to cite is, there are studies out there that show that a man's nutrition will alter both the quality and the quantity of his sperm, and therefore forever alter. So a baby is affected just by a man's nutrition prior to conception. Nutrition of a man is that important that it can affect the quality and quantity of his sperm. What do you think a subluxation can do? Obviously, it can rob that sperm of its fullest potential, and therefore it could decrease both the quality and quantity of sperm that is produced in the male. Same thing for the woman. So we always talk about as the birth process being the first subluxation. Challenge that. I always challenge that, because I think it happens way before that. I think the first subluxation happens in utero for a lot of babies. I think the first subluxation happens prior to conception for a lot of these babies. If mom and dad are stressed out, that's going to affect the baby. It's that simple. And we have to address that.
Absolutely. Yeah, a lot of times, like, just stress in general, like whether it be mental or physical or whatever, that adaptability is key, taking that subluxation away. So that was a really great explanation for the preconception. And so what I wanted to move to now was, so the mom and the dad didn't get under care, and now they're pregnant. And they walk into your door because somebody told them morning sickness or can be helped or something like that. And how do you, but they're skeptical. So how do you relate, this subluxation to something in the first trimester, for like very beginning? Or how can the subluxation, what are some common issues and things that you have to talk about with them that help them bridge that gap?
So here's how I see it. The best time to get under chiropractic care is the minute you're born. The second best time to get under chiropractic care is right now. So they may not have had the benefit of being adjusted since birth. They may not have had the benefit of being adjusted since they were a child. They may walk in at 30 years old, 40 years old, 20 years old. They may walk in already midway through a pregnancy, and they're coming in either because they're having hyperemesis, where they're vomiting all the time and having morning sickness. They may come in because they're having low back pain, or their feet are swelling, or somebody told them that chiropractic during pregnancy can shorten their labor and their birth. For whatever reason they walked in the door. Wherever they are right now, we're going to meet them right there. I'm not going to make them wrong for not being here sooner, but I'm going to try to make sure they understand that they're going to do things differently and everyone else that they come across, whether it's their mother, their father, their babies, their cousins, their friends. So if we start somewhere in the middle of the pregnancy, I always like to talk about the fact that maternal stress is one of the most damaging things on an unborn child. So if mom is stressed out because of finances or work situation or because of abuse situations or relationship issues, if mom has stress on her during the pregnancy, especially during the first trimester, it will affect the development of the baby's brain, and it will affect the development of the different hormones and the way the baby processes those hormones for the rest of their life. It's been shown that children born into abusive situations tend to be more aggressive. They tend to be more violent. They tend to grow up to become this really heart-wrenching is the best word I could use for it, heart-wrenching ultrasound on a baby in Italy while the mother was being screamed at. And you saw the baby flinching in the ultrasound. And they followed that baby, and that baby turned out to be the classic street fighter, you know, huge forebrain, real aggressive, not a one-off type of situation. They know this. We know this. I know this for sure. I see it in my office all the time. About reducing the effects of stress on their nervous system and ultimately on the baby's nervous system, because everything that goes through mom, and if we can make sure that mom is living at her best potential, unsubluxated, checked and adjusted whenever necessary, then we can make sure that she's sending the best nerve supply, the best blood supply, the best oxygen, the best nutrients to her baby, the best mental attitude, and the best loving, nurturing care that she can. Then she sets that baby up for such a greater life.
Oh yeah, I was talking with Dr. Drew Rubin the other day, and we were in class. He knows so much, it's crazy, but he was telling us that the number one related factor in children who are diagnosed with like autism spectrum disorder is schizophrenia in the family, the immediate family or distant family. But the number two related factor is a high stress level during pregnancy and the inability to adapt to that stress. So that stress really affects in a major way.
Especially in male children, because the stress on a mother during pregnancy actually creates increased testosterone. Testosterone, if it's a male child, what it does is it will cause the two hemispheres of the brain to not communicate in sync. Is going like this, and the other side of the brain is going like this. And so those children will typically be labeled either on the autism spectrum, or they'll be labeled ADD, ADHD, and then they're put on chemicals, right? Drugs, toxic chemicals for the rest of their life. So it's so important to have this conversation as early as possible and as often as possible so that people can understand you never have to go down that route. If you can keep the body balanced, if you can keep the spine in alignment, if you can keep the nervous system functioning and communicating freely without interference, then the greatest capacity for healing and health is within us. It doesn't come from the outside. It doesn't come from a pill pot, pill bottle, potion, lotion, that whole saying. It comes from within us. And it's the truth. And it's the truth whether you're talking to a 29-year-old male or an 80-year-old woman or a child or a baby in the womb. It is the truth. To allow their body to function at its best level will produce the greatest health.
Absolutely. That was awesome. So it is so majorly important once these people are in your office. And so I had this question that our last webcast with Dr. Tullius, he talked about his son having been put on the spectrum. And so he actually went out of his community and went to one of the autism group, like help for parents and families with autism, and just talked and was genuine, and ended up, they asked him to speak about chiropractic at their next event or their next meeting. And so for that's great. And so it made me want to ask you, so for someone who is becoming pregnant or is pregnant, what are some avenues that we could go into our community And really, what are the groups that really need to know about chiropractic in relation to pregnancy? Do you know of any that are in your area or national organizations or anything like that?
Depending on where you practice, you may have a birth network that's already established. For example, San Diego has a San Diego birth network, and I've worked with them, and they're brilliant and they're vibrant and they're dynamic, and they're getting together midwives, doulas, lactation consultants, birth coaches, chiropractors, nutritionists, and moms. That's the big thing. They're getting the moms together. So it's not just these healthcare providers, it's the moms who are getting together with these women in the San Diego Birth Network, so that they can learn about healthier pregnancies and better birth outcomes, so that they can start to understand that really I am responsible for what I do to my body and ultimately what gets done to my baby's body. So we have to take responsibility as chiropractors. And I think if you don't already have a network set up, if you don't already have a way to reach out to people, if you're not already out there giving talks, or perhaps you're not comfortable giving talks, if you're not writing articles or sharing information with people in your community, then you might want to get hooked up with the people that are doing it, which usually is the type of people that would fall into a birth network: your lactation consultants, your doulas, your midwives, your birth coaches, type of people who will help get your message in front of pregnant women or women who are struggling with fertility challenges. And I mean, you might get involved with yoga studios that deal with prenatal yoga. You might get involved with fitness studios and personal trainers that know how to work with the pregnant population. When you get around those people and you start sharing your information and you start teaching the providers or the fitness professionals, then they start sharing that information with their patients and their clients. And I think the one easy door opening sentence that you can share with anyone that will absolutely get them to pay attention is the simple fact that chiropractic during pregnancy can reduce a woman's labor time by 25% during her first pregnancy and up to 40% during successive pregnancies. Now, that is, for many women, the only reason they need to hear to get under chiropractic care. Because if they've ever had a lengthy labor, if they've ever had a difficult labor, if they've had a traumatic birth, some feelings that may be causing them to either not want to get pregnant again or to experience some difficulties during their pregnancy just because they're so nervous about how the birth will turn out. When they hear that, they're like, you know what, if that's what chiropractic does, I'm all in, because I don't want to go through what I went through last time.
And what does thinking about that do to the mom and while she's pregnant? Like, takes us right back to stress. So
right. And it's if a woman is stressed out, if she had a prior difficult labor or a difficult birth, then mentally and emotionally, if she has not gotten over that, if she's still harboring some of that, and sometimes women will actually harbor that physically, like they'll have pelvic pain, they'll have pubic symphysis pain, they'll have difficulty having bowel movements, you know, they will have physical results from a difficult labor that the mental may wear away, but the physical is still there. So it's constantly reminding them. So as they get further and further along in their pregnancy, resurface. And then they start to have this kind of unsurety about their body, and they start to not trust the process. And then they become a little bit afraid. And when they become afraid, they go into fight or flight. When we're in fight or flight, you cannot have a natural, easy birth, because every time a contraction comes, you're going to tense up and you're going to resist it, and you're going to go into fear, and you're going to have adrenaline coursing through your body. And instead of just relaxing and letting the oxytocin take over, you will be in the wrong mental state, which means the woman most likely will end up going the medical route with interventions and, you know, C-sections, or what I call unnecessary sections, right? They'll just end up going that route because their body will shut down out of fear.
That's so true. So that really kind of, these webcasts are supposed to be pretty short, and that really kind of hit the nail on the head with what I wanted to portray. Is there anything else that you think that's important that we need to know on this topic, that maybe a conversation you've had that it pops in your head with a patient that really helped them, or just something in the community, or anything that could really just, they need to know, our viewers?
if I had to say one more thing that people need to know, it's that don't make your patients wrong. They do. If they end up with a C-section, time about it, they already feel defeated. Vaccinated their first child or their second child, and they're having issues with that child for it, they're already blaming themselves. So don't make people feel guilty. If they're having fertility challenges, don't buy into the conversation that it's his fault or it's her fault, or, you know, it's your fault because you're working too hard or you're subluxated, and, you know, let's just see what we can do to help your body. Don't make people wrong, because women are walking around with so much guilt already as it is. I mean, there's mom guilt everywhere you turn around. We don't need to add to that. What we need to do is we need to empower our people, our patients, our community, so that they can make educated decisions about themselves and their family. And we're only going to do that if we bring them the information in a non-threatening, non-judgmental way, and just allow them time to process that information without feeling like you're going to jump down their throat if they don't choose what you're leading them toward.
Yeah, that's a really crucial crucial thing, because we all feel that. Like we've all been there. We've all felt guilty about something that we didn't know about, and so we can definitely all relate. Thank you so much for joining us tonight. I know that you have a very busy schedule. Today was first day of school for the kiddos. So thanks for taking time out of your busy day to help us learn a little bit more how to take care of children better, and pregnant mamas better, and just helping as many people as we can in the profession. So I'd like to, ma'am? And
spread the message.
Oh, yeah. And speaking of spreading the message, we're going to see you again October 7th and 8th at this year's Pediatric Summit in Atlanta at Life University. So for all you guys looking at or watching us out there, I really hope you can make it. It's going to be a fantastic event. If this is your first webcast that you're watching, let me switch over to me so you're not just looking at her looking. If this is your first webcast, there are 7 more that we've already done that are already out on our YouTube channel. If you don't get our emails, sign up to get our emails. We're constantly sending out webcasts and information. Just a couple months away, and the best pediatric and pregnancy seminar on chiropractic that there is this year. So, in my opinion, there's not going to be a better one. So I hope you all join us. We'll see you soon. Thank you.